Hi, Laura.
Hi, Greg. What's on the agenda for today?
The topic of aging, but you gotta promise, no over-the-hill jokes at my expense.
Don't tell me you're sensitive about your age.
Well, we reach our physical peak around 25, 26 years old. I'm 41. My first gray hair is ancient history.
Oh, come on now. Aren't you being just a little bit dramatic?
Well, maybe a little. The cumulative effects of aging aren't really noticeable until later, till we reach our 50s. But I can see myself changing already.
Oh, yeah. Now that you mention it, I can see some wrinkles.
Okay. But it's true. Our bodies change as we age.
We begin to wear out?
I thought we agreed no jokes.
Okay. No jokes.
Adjusting to physical changes can be almost a full-time job. There are aches and pains.
Like arthritis or back pain.
It can hurt just to walk.
Ugh.
It takes longer for an elderly individual to recover from illness, as much as 3 times longer than a younger person.
Wow. I didn't realize that. That's quite a change.
And an elderly person who's ill is at more risk for complications like pneumonia, infection, and emotional problems.
Emotional problems? Kind of like what you're going through?
You're doing it again.
I promise to stop.
Muscle and bone structure change as we age. We don't have the same strength we used to.
I know that osteoporosis is a bone condition that's common for women. Not enough calcium, and the bones become fragile and can even fracture.
Yes. Then there are psychological changes that accompany aging. Maybe it's harder to recall certain facts. Maybe it takes more time to learn something new.
So much more time that you want to give up.
And the older person may have problems concentrating. Just the fear of forgetting can make concentration difficult.
That's not a very pretty picture.
Well, think of it as a worst-case scenario. More encouraging is the fact that the number of people over age 65 is growing. People are more healthy than ever and are living longer.
Then you won't be lonely. I'm sorry. Living longer, living more healthy. Is that true as well for people with developmental disabilities?
It sure is. And it's due to things like better health care, better living habits.
That's great.
But even so, as we get older, many of our needs change.
Like healthcare needs.
Yep. And as needs change,
The services change.
or at least change their emphasis. We have 4 main goals to meet the basic survival needs of an elderly individual with a developmental disability. The goals are economic security, access to adequate health services, access to needed teaching, access to other needed services, including advocacy and guardianship. Let's discuss them one at a time.
So the first goal is economic security.
Old age can be a very uncertain time financially, especially if you're developmentally disabled.
I know that a lot of elderly people have a difficult time making ends meet.
That's true. That may be why economic security is a top priority among the elderly parents of adults with developmental disabilities.
The parents are concerned for the well-being of the individual after they're deceased.
You bet. And economic security is so important that many elderly parents would rather see their adult children living in a more restrictive setting that's financially secure.
Instead of living in a less restrictive community program or on their own?
That's right. Economic security starts with affordable housing, decent food, and medication.
What about other expenses?
Economic security means living at more than just a bare subsistence level, from one meal to the next, from one day to the next.
You're talking about having some money left over after paying for food, rent, and utilities.
Yes. Real economic security takes financial planning.
But what does the individual with developmental disabilities have to plan with?
There may be Social Security. If the individual's employed, maybe there's a pension plan. Maybe there's life insurance.
Or savings?
Could be. Relatives can use financial planning to set up wills or trusts. The parents of one individual purchased a condominium for her and set up a trust to continue payment of taxes.
To assure that she had a place to live in the community.
Now, not all parents are able to do that, but a small trust could provide a weekly or monthly allowance for an elderly son or daughter with a developmental disability.
It could mean the difference between having and not having available spending money.
That's right. And the earlier the financial planning starts, the easier it is and the bigger the ultimate benefit.
Waiting till age 65 may be too late.
Right.
So it's a matter of making a plan that makes the most of available resources.
Exactly. The second goal is to assure access to adequate health services.
Adequate health care seems to be a problem for many, many people.
It's a special concern for elderly individuals with developmental disabilities.
Why is that?
Well, several reasons. First off, elderly people with developmental disabilities have additional health concerns.
Due to their disabilities.
Yes. And while taking medication is always a serious business,
Because of side effects.
when a person takes more than one medication, the drugs may interact and cause additional side effects.
So a person who already takes medications due to a developmental disability is at greater risk when more drugs are prescribed for the problems of aging.
That's right. Additional drugs increase the potential for dangerous medication interactions.
I get it.
Then there are the effects of long-term psychotropic drug usage.
Psychotropic?
Psychotropic medications were often prescribed to people with developmental disabilities to reduce challenging behavior.
Aggression, property destruction, self-injury.
Psychotropic medications have side effects that can dramatically alter a person's behavior.
Really?
Yes. And the longer you take a psychotropic, the greater the chance of a permanent side effect.
So an elderly person who has taken a psychotropic medication for years and years is at greater risk.
Exactly. The elderly person with a developmental disability is at increased risk for heart disease, for respiratory problems, and for cancer.
I didn't know that.
We've got the medical technology to solve a lot of health problems associated with aging. The problem is that some individuals with developmental disabilities can't communicate the problem.
Can't say when they're ill, where they hurt, or when they feel better.
Right. So when an elderly individual with a developmental disability does complain of an ache or pain, we take it seriously. We're extra vigilant.
Are you talking about extra health checkups?
Health checkups are important. But between checkups, we need to be alert for any symptoms that might indicate a change in health status.
Symptoms like,
Like unusual bleeding or skin changes or difficulty walking.
how about problems with vision?
Well, that might indicate a condition like glaucoma or cataracts. Watch for sudden weight gain or sudden weight loss. Watch for side effects and adverse reactions from medications.
Whenever a new medication is prescribed?
Or when a current medication is withdrawn. It's especially important to watch for symptoms for people who can't report the symptoms on their own.
I can see that.
You know, health status changes can be scary.
What can I do?
Support the individual with information, answer questions honestly, and take the time to explain what's going on when a change occurs.
So it isn't so scary.
Right. If there's a medical procedure planned,
Like an operation or x-ray?
explain in advance using pictures, diagrams, and whatever else is available.
To help the person adjust. What about when a new medication is prescribed?
Good point. Help the individual understand the reason for taking the medications, the schedule for the medication.
And any potential side effects?
Yes. Now, adjusting to changing health needs can mean the need to learn new skills. So the next goal is to ensure access to teaching,
To learn to use a walker, to use and care for a hearing aid.
to learn to lift at the knees to prevent back strain, to eat with a new diet, to take your own medication. It also means learning new technology.
Like computers?
Sure, learning to use a computer, a VCR, a compact disc player.
If you lose touch with technology, you can lose out on a lot of convenience and enjoyment.
The elderly individual may need additional help to learn, additional practice.
Or more teaching time?
Yes. The elderly individual may need special aids to assist with remembering,
Like
picture instructions to follow to remember how to use the microwave oven.
I have help with those.
The chronic pain that comes with arthritis, vision problems, poor eye-hand coordination, and other conditions of aging make it more difficult to care for self.
It takes longer to do things like dress and bathe.
And it's more complicated. But if other people do it for you,
You lose the skill.
exactly. So we not only teach new skills, we help individuals maintain the skills they already have.
I can see that's important.
For some individuals, just maintaining skills is awfully difficult, and skill maintenance is the main objective.
I see.
The next goal is to assure access to other needed services.
What kinds of services?
Well, there are support services.
Oh, like occupational therapy?
Sure. Suppose an elderly individual with developmental disabilities can't complete a work task in the same way any longer. An occupational therapist may be able to recommend or create an adaptation to assist the individual.
So that the individual doesn't have to leave the job.
Then there are supportive psychological services.
What do you mean?
Well, aging is scary. Elderly people need help. Help with the grief when a family member or friend dies. Help with any anxiety that comes with a prolonged illness or approaching death.
I can see how that's important.
Support services include personal assistance with living, arranging visits with friends, arranging transportation, legal assistance. The list is endless.
Support services seem to tie up the loose ends.
Services need to be coordinated.
Service coordination to make sure that everybody on the team is working together.
We do everything possible so that elderly people with developmental disabilities can access all the services available to other people in the community.
Others who are not developmentally disabled.
Yes. Every community has community-wide recreational activities.
There are Park District, YMCA, YWCA-sponsored activities.
And community transportation. But sometimes there are barriers to elderly people with developmental disabilities participating in community activities.
Barriers?
Barriers like a lack of acceptance of people with developmental disabilities into programs designed for other elderly people.
That's discrimination.
It sure is.
What can be done?
We advocate for individuals on their behalf as well as teach individuals to advocate for themselves.
So that services in the community are available to all.
Right. At the same time, we work to promote understanding and acceptance through education.
What sort of education?
Training in both developmental disabilities and gerontology for all service providers.
Sounds like an attempt to cooperate.
We've got to cooperate to make this thing work. Elderly people with developmental disabilities shouldn't be set apart from others. We can all benefit from and enrich the lives of other people of all ages.
So, we work with other service providers to integrate activities and prevent age segregation.
That's right. Young or old, disabled or not, it all comes down to the fact that if a person's basic needs aren't being met.
For economic security, for adequate health services, for teaching, and for other services.
There's no chance for a person to gain the self-esteem that comes from living in the community with dignity. But aging and living with dignity is our topic for next time. See you then.
Thanks, Greg.